Good morning, good morning. Hey guys, I had a question asked by a patient today. I just wanted to run through it with you guys. I get asked quite frequently, can I get adjusted after surgery? It can be shoulder, it can be neck, it can be back, it can be pretty much anything. And this is a real concern for patients because you just had something surgically repaired. You don't want to do something that could potentially harm it, correct? And I certainly don't want to do that either. So what we're going to take a look at today is just some of the things that you can and can't do. Obviously, number one, the thing that we're going to talk about is appropriate healing times. Okay, so with the appropriate healing times, when we're talking bony fixation type issues, we want to make sure that we're giving it at least 6 weeks, 8 weeks, 8 weeks minimum to allow that to heal. Every case is a little bit different because of the way that each surgery goes. So we want to make sure that we're giving you guys the appropriate healing time. I generally coordinate with your surgeon and we get an idea of how the healing is going. We take a look at the imaging that they do post-surgical. And we just kind of go through a really good functional movement evaluation to see what's happening. These are all really important factors because every case is different. Okay. Now, on a soft tissue side, generally, if you're released to do physical therapy, you've probably been released to do chiropractic care and some other rehab things that I do. All right. So it's important that we make sure that we're keeping you mobile, but also that we're keeping you stable. All right. One thing that I tell my patients, I am not in the business of doing full post-surgical rehab. I have some physical therapists that I work with that are amazing on that side, and I would much rather shift you over to them. However, on that side, I work with those physical therapists pretty routinely, and I work with those surgeons and the other MDs to kind of get you that boost that we're looking for with the FDM work that I do and some very specific functional range training that we need to do. So if someone's not progressing as well as you would expect or as much as you would hope, that's where my skill set kind of comes in, and we start working a little bit more in depth onto some of the soft tissue work to break up scar tissue that's not forming correctly, work on improving range of motion that's not coming back as good as we would like to see it. So like I said, I am not in the market of post-surgical rehab, but I do act as an adjunct to that. Okay, good rehab is by far and away one of the biggest things that you can do to make a surgical intervention successful. Okay, and so I have a couple different therapists that I work with on that side. On the soft tissue side, FDM has been proven very, very safe, just like many other soft tissue techniques. Basically, it's that 6 to 8 week marker is generally what I'm looking for because we want to make sure that we're not pushing the tissue past its okay stress point. Now, I may not work specifically on the surgical site until everything is completely scarred up and completely healed with the skin tissue because we don't want to be breaking open any old stitches or anything like that. But making sure that we get the fascial distortions under control and we make sure that we aid in healthy scar tissue is really, really important to make sure that you get your proper range of motion back and make sure that you're able to live the life that you want to live later. Okay, I've found that the faster we can get to these things, the quicker they resolve and the less long-term issues you have. Okay, if I have somebody who had a surgery 10 years ago, they don't quite respond the same way that somebody who had surgery 10 months ago or 10 weeks ago had. The faster we can get to it, the better off it generally is. So what we're taking a look at on that side is a case-by-case basis. The other thing that we need to look at is getting adjusted. So if we're looking at an extremity, more than likely, I've been trained in many, many ways to adjust people around surgical interventions. One of the doctors I used to work with had a ACL replacement. We were able to adjust him the next week because we were able to work around that knee. All right, so that's pretty easy. Same thing with shoulders, elbows, wrists, all that kind of stuff. Spine's a little different. Spine we have to take a little bit more care with, but it doesn't mean that you can't ever get adjusted again. It's actually more important that we take care of that spine post-fusion or post-microdiscectomy as long as we give it the appropriate healing times. It's really, really vital because of the fact that when you immobilize one joint, our body is an amazing compensating creature. And what it will do is it will begin to make the joints above and below move too much. Okay, we want to preserve the motion. We want to be able to do the things we were able to do pre-surgery, and so you'll begin to see a lot of excess motion above and below. And if you end up with that issue, you can create a lot of pain and a lot of trouble with that. So one of the things that we have to try and pay very close attention to is overwear of the joints above and below. Okay. With that, we have to take very close care to what kind of surgery was done. If someone had a fusion, I'm not going to go in there and just start hands-on racking it. That's not the greatest idea in the world, as you can imagine. But what I am going to do is some very focused things above and below the joint, especially in the segments above and below. So we just have to make sure that those are mobile and taken care of. If any of you guys have any questions, please don't hesitate to reach out. Give us a call. It's 806-319-7441. And we can answer any of those questions for you on a case-by-case basis. And if you have any really detailed questions, come in, get yourself set up for an evaluation. One of the policies that I have is if I don't feel like I can help you, I'm not going to bill you that day. That's just something that I really try to believe in heavily. I try to get you where you need to be. That's not my goal. Isn't to make money off somebody I can't help. Okay. So if you guys have any questions, don't hesitate to give us a call, and we'll be here for you. Have a great one.